Hello, I'm Ned Koppen, President of the Fairmont Area Chamber of Commerce, and today we're going to be speaking with Dr. Corey Welchlin. Hi, Doc.
My pleasure. Good to see you again.
So, you've been a longtime resident and practicing in Fairmont for a long time. Tell us a little bit about your history here in Fairmont and Martin County.
I was born in Martin County, born at the old hospital across from the lake there, and I'm one of four boys. My dad grew up by Northrop, and so we always doctored down here when we were young. And then my dad farms up by St. James, and he's still on the farm. He's 94, and Mom's 87, and they're
Wow.
still on the family farm. And so that's why I came back to the area. Went to St. James High School, graduated in '76, and when I was in high school, I ran a lot, track and cross country. And the reason I ended up doing orthopedics and going into medicine is my dad said I had three choices. I wanted to farm. And he said you have three choices. You either be a lawyer, a doctor, or a pilot, a commercial pilot. And I'm like, and he said basically going to college for 1 year no matter what. So I started out at Gustavus, and the reason I went to Gustavus is it was an hour from home, and I could have a car.
Sure.
And I already had a car, so I had to have my car. So that's where I went to Gustavus, and the pathway just kind of led to going into medicine. And the reason really was my high school biology coach, Don Hansen, was my biology teacher and my track coach. And he was just incredibly challenging and hard on me, and really kind of directed me into going to medicine. And while running high school, I had a stress fracture in my leg, and I had no idea what it was. My family doc didn't, chiropractors didn't, nobody knew what it was, because it's kind of a new thing back in the 70s. Nobody really talked about stress fractures. And I ended up going to a doctor, and he got an x-ray, and he thought it was a tumor on my tibia, my lower leg bone, and put me on crutches. And then my dad said, that's ridiculous. and he's a farmer, he knew what he was talking about. He delivered calves. So anyway, so he sent me to an orthopedic surgeon in Mankato. And it was either Dr. Lippman or Swanson, one of those two guys. And they said, no, you had a stress fracture, the bone broke, that bump of bone is you healing. And I'm like, really? And so it was very nice that they helped people in that manner.
Sure.
And so I think that kind of led me down the orthopedic path.
Light bulb went off.
Yeah, and it kind of stayed with me. And so when I got into medical school and I got to my residency, going toward residency, I still wanted to be a family doc. And then one of my friends said, you got to hang off the orthopedic guys and see what you think. And so I started hanging off orthopedic guys. This is in Flint, Michigan, with the residents. And I'm like, this makes perfect sense to me. You see somebody, you see a problem, you fix a problem, and you see some more people. And you're not, doing the chronic care thing,
Sure.
which is great. And I think wonderful that primary care people do that. But my skills seem to be in the orthopedic realm and surgery and helping people from a sports medicine and reconstructive process. There's a general surgeon in Michigan named Dr. Sosi. And Dr. Sosi, I asked him when I was an intern. So I was just right out of medical school. I said, how do you know what to go into? And he says, go into something where you help people. And if you can help older people, they'll always thank you. And I'm like, that's ridiculous.
Has it worked out?
It's so simple. And it's exactly right. I mean, older people are so thankful. Athletes are too, and everybody is. But older people, if you can help them explain something, it's very, very helpful.
Gratifying too.
Yeah, it is. And so when I got, within 2 years being done with my residency, I started looking at coming back home from Michigan. And I came to Fairmont because it was home area. And Dr. John Holstein was instrumental in encouraging me to come back. And the hospital gave me basically an interest-free loan, a guaranteed loan to allow me to come back and start my practice. So I started my practice at the hospital, and I was there for, I think it was 8 years, and then Mayo came in and bought the hospital and the clinic group. And so then we had to do something different. And then that old Pomida building that we knocked down and made Victoria State Crossing, the lawyers and the dentist and myself got a group together and built the first building.
And that's how you landed there.
That's how I landed there. And then built our surgery center and put in our MRI scan. And then after that, we expanded to the point of volume that I needed to build a two-story building behind Slumberland.
Yeah.
Yeah.
Well, that's a pretty good story.
Yeah, it is. It's kind of fun to look back at. It'll be 30 years this summer, which is just ridiculous.
It's a long time.
And the sad thing, when you turn 60, I'm 61, then everybody says, when are you going to quit? And I'm like, I like what I do. I enjoy what I do. Well, if I stopped practicing medicine, then I would only worry about golf, and I'm not good enough at golf to worry about just golf. So medicine, it keeps me out of that depressive mode.
It's a good choice.
Yeah, I think so.
So that's the history. you want to tell us a little bit about your business, Center for Specialty Care?
Yeah, we started out as Fairmont Orthopedics and Sports
I
Medicine.
remember that.
And we did that and only that name because I wanted to be incorporated, and that's what the tax people and lawyers said, that's how you should do it. So I did that, and then we started going to our Blue Earth office, and Blue Earth people didn't like going to Fairmont Orthopedics, and so in Blue Earth, and so then we changed it to the Center for Orthopedics and Sports Medicine, and it was that way for a few years. Then we had a practice in New Ulm when Dr. Garski was with me, and a couple other towns, and then I had an opportunity to employ a couple general surgeons and internal medicine doctors, and people asked me for many years, are you going to go into primary care ever? And so we started having primary care clinicians, and so Fairmont Orthopedics didn't ring a bell very well with all the other things we were doing.
Right.
So then we switched to Center for Specialty Care, and that's been a pretty good switch for us.
Right out there on Highway 15 and Victoria Street.
Yep.
Right at the intersection.
Yeah.
So give us a quick rundown or an overview of the services that you guys offer.
Yeah, in primary care, we do outpatient wellness stuff. We do a lot of women's health stuff. We have 2 nurse practitioners that are trained in that. I have a primary care doctor that we've agreed to terms. He's going to start in a couple of months, a young guy right out of training. He'll be
That's
wonderful.
Great.
And so we'll have 3 primary care people then. The primary care people do an allergy program, which is only one in town. And we do a Center for Medical Weight Loss. For years, I've been looking for, I have all these people that are large, and anesthesia, rightfully so, says they're not a good risk for a surgery, and there's all these other little weight loss opportunities for people. I wanted a medically based weight loss program. We found this one, and it's wonderful. My nurse practitioners or primary care people can see people, interview them, go through a screening program, set them up on a process to help them lose weight, monitor it, and the medical visits are paid for by most insurance companies. There's so many per year by Medicare, Medicaid, Blue Cross. We have all that figured out, so we can see those people and help them out and help them lose weight. We got people down 50, 60 pounds from doing the program. And when I interviewed different programs and looked, one guy out east, he quit doing primary care medicine. He said, I just do weight loss. My people love me. I love taking care of them. And I said, how many people have you sent off for bariatric surgery? He goes, 0. I've taken care of thousands. And if people follow our program, they don't need a bariatric surgery. I'm like, that is powerful stuff.
That's a good story.
Yeah. So we do the Center for Medical Weight Loss. We have an allergy program we do for people with environmental allergies, molds and mildew and mites and things like that. My own son had this throat thing going on forever, and we figured out he had mites, a mite allergy and a dog allergy, and all went away. From an orthopedic standpoint, Dr. Haas, Jonathan Haas, joined me about a year ago. Wonderful surgeon, did a fellowship in total joints, so he loves doing total knees, total hips, total shoulders, plus general orthopedics. And he's been with me about a year, does a nice job, very nice gentleman, very talented surgeon. And so we're the orthopedic people, him and myself. And then we have those primary care people I mentioned, Holly Katava and Revity and Quasted are the 2 nurse practitioners. And then we have the new primary care guy coming. He's got a Minnesota license in March. It'll be about another month until he can start seeing people after he gets his license. And then we have a pain doctor, Dr. Faltez, who comes down from the Twin Cities. And he's an anesthesiologist that did a fellowship in pain or injections of people. Wonderful, wonderful, talented gentleman, very nice to people, and very, very good at what he does. And so he gives people injections for chronic pain of their neck or back or other places. He'll come in and once or twice a month and do 15 or 20 injections plus 2 consults, which is a great adjunct for the Fairmont area. So we bring people in from 50, 60 miles to see him. Just had a patient in yesterday from Blooming Prairie that found us online for chronic back pain and neck pain and issues that had 3 surgeries elsewhere, and I think we're going to help that person a lot. And so we're kind of an interesting referral from a lot of areas. The website has been very helpful. Facebook posting has been very helpful.
Sure.
So Dr. Faltez is the new guy. Dr. Haas is new. The newest thing we're really offering right now that, as I belong to a surgery center organization, because we have a surgery center, which is basically for outpatient surgeries. And when I opened it 19 or 20 years ago in the one-story building by the bowling alley there at Victoria State Crossing, back then you just did carpal tunnels and knee scopes and very simple stuff. And now we have a general surgeon that comes, Dr. Lee. He does gallbladders, all the colonoscopies and upper scopes, hernia repairs. We've done
full gamut.
We've done appendectomies there. People go home the same day. I've done knee replacements, hip replacements, cervical spine surgeries, lumbar spine surgeries, the rotator cuffs, all those things outpatient. And it's been wonderful. We have a eye surgeon, ophthalmologist from Mankato that comes down to surgeries every other Thursdays in there. Very helpful, plus Dr. Folt is doing the injections besides. But the new thing that we're starting, because the Surgery Center organization is something called price transparency. And so with people's insurance deductibles, insurance premiums, their co-pays so incredibly high, $6,000, $7,000, $8,000, $10,000 per family. I've had people say, "Can't I just do this for a cash price?" And we did a lot of research.
I've heard of that.
Yeah, so we did a lot of research, and in the Surgery Center journals, I've contacted 10 or 15 different surgery centers. So we're just starting this ourselves. It'll be on our website next week. Price transparencies. So if you needed a knee scope, you can look at my website and say knee arthroscopy or knee scope, and it would be one price. And that would include the facility, the use of the operating room, the use of the surgeon, and the use of anesthesia for one price. And that price is way below what your insurance rate price would be. So it's for the person who doesn't have insurance, or the person that says, "I'll never get through my deductible to be cared for." And
You're giving people options is what you're doing.
A very good option. And a lot of surgery centers have done this and found people love it. A lot of times you go in for a surgery and they do 2 or 3 things, and now you get 2 or 3 bills rather than the 1 bill, and you're paying a percent of those 2 or 3 things that are done. Especially in orthopedics, I'll do 3, 4 things in a shoulder at times, and then those are all different CPT codes or billing codes. But we'll do it for one price.
It seems that it might be kind of hard for people to understand the differences between their insurance coverage and a cash pay. Do you guys do a good job of educating people and helping them understand those differences?
Yeah, you'll be able to look on the website and say whatever surgery you've been told you need or you think you need, and see is this what the price is. Now, if you call our office, we'll have 2 people that are highly educated in this. They can sit down with you either on the phone or come in and sit down with them. And they'll be able to go through and say, okay, here's your insurance. Here's how your insurance plan works. This is what your deductible and copay and how it plays out. And I don't know if you know this, but you can look on websites. We look all day long at people and say, okay, they have Medicare, they have Medicaid, they have UCare, they have Blue Plus. They've used this much of the deductible. This is what it's going to cost you.
Okay.
So going into a given surgery, we can come very, very close into telling you, if you do this under your insurance plan, this is what your out-of-pocket's going to be. This is what our cash price is. This is what it's going to be. And we encourage you to go call the hospitals or medical centers around here and say, okay, what's your price? What's it going to cost me? We know our fees are about 60% of a hospital fees.
Right.
So we know we're competitive. I don't think as many people know how competitive we are. And the reason we built a surgery center was be cost effective, to be efficient, and to save people money. It's ridiculous what healthcare costs. And so we know what our costs are per case, and so we can help people figure out what's most cost effective for them.
Again, giving them choices.
Choices, absolutely. That's what we have.
So, Dr. Welchlin, I think we all know that the medical field has changed a great deal over the last 20, 30 years. Maybe tell us a little bit about how your practice has changed briefly, but more importantly, where do you see yourself going in the future?
It has changed a lot, and it used to be really easy to do it. When I was in Michigan training, people used to come in and say, do my carpal tunnel surgery next week or 2 weeks from now. We go, why? He goes, deer hunting season started. I can take 6 weeks off and go deer hunting. And it cost them $50. Their copay was $50. And so they were like, whatever. I got time off, I got this disability, short-term disability I can have done whenever I want. A lot of people tended to think that way. Now everybody's like, what's it going to cost? What's it going to cost? How does it affect me? And I bet on a weekly basis, I see 5 or 10 people like, well, I'd love to do that, but. Well, now I think we have a reasonable opportunity for people to say, okay, yeah, that makes sense. I can do that. We can figure out a payment plan and get that done for you.
And that's great because being hurt, living with pain, that's a hard way to live.
Yeah, and the other thing that's really changed and where the healthcare is going, when I came to town, I started doing joint replacements on people. I've done 4,000 or 5,000 joint replacements. People used to say, I'll be here 2 weeks, right? And I'm like, no, you'll be here 3 or 4 or 5 days. And it was hard to get them out in a week.
Right.
And people were used to, and not that anybody did it wrong, people were used to laying in bed for 4 or 5 days before they moved. And I'm like, no, you're going to get blood clots, you're going to get pneumonia, you can't lay around. But that's kind of like the old dogma of what you did with joint replacements and spine surgeries and things. And now, I do hip replacements in my surgery center. People are home 6 hours later. Knee replacements, 6 hours later they're home. And I tell people, you can control your pain. You can have your glass of water, and you can have a snack, and you can have your bottle of pain pills and your remote on your lap, and you can control where you're at. We do great post-op pain blocks that help people. Medicare every year will throw in another 5 or 10 surgeries that you can do orthopedically outpatient. And so last year they allowed knee replacements to be done outpatient at a hospital facility. In 2020, now you can do knee replacements at a surgery center outpatient and send people home under Medicare.
That's a big change.
Hips now this year are being done outpatient at a hospital, can go home the same day. And then next year they'll probably be released to be done at a surgery center outpatient. And I've done people, I had a patient from Wyndham, a young lady, she was Medicare, and she wanted me to do an anterior hip replacement. And I couldn't get her done at the hospitals during December because it's a crunch month. And she goes, "Can you do it at your surgery center?" I said, "Yeah," because I'd done it before. So we did one hip outpatient at the surgery center. She went back to teaching. She's an older lady that teaches, and did it for a cash price. And the next year she came back and said, "Do my other hip during Christmas." I said, "Well, we can get you at the hospital." She goes, "No. I want it done right here because it was great. I went home the same day. I was comfortable. It was wonderful." And her husband got to go to Edie's and have breakfast while she had both her hips done. She was thrilled. He was thrilled. It was a good deal. So I think the outpatient surgery thing is going to continue to grow and grow and grow. And that's just where it's gone. And I think it's incredibly safe. The anesthesia is good. Infection rates are low. Care is great. So I think that's a big opportunity. We'll continue to grow in primary care because there's a need for that in the area. Good outpatient primary care is always of great value. The one thing I forgot to tell you we offer now that we didn't used to is stem cell and PRP injections for arthritis.
Really?
And we do a fair amount of those, and it really, really helps people. And the studies are showing it's really cost effective for people. So somebody 45 or 50, rather than replacing their knee, you can help, or hip, you can really help them, make them very comfortable with these injections that are their own tissue, spun down, and then injected back into the respective joint.
If somebody needs more information about Center for Specialty Care and the services that you offer, where would they go?
We have a website, centerforspecialtycare.com, and that flows to a couple different people if you email us a question, want an appointment, those type of things. My son Carter joined me about 1.5 years ago. He's my social media guy, my website guy. He did a marketing degree at St. Thomas, which broke my heart because I wanted him to go to Gustavus, but he chose St. Thomas. Anyway, he's my marketing guy, social media guy. So he does our Facebook, he does our Instagram, Twitter stuff, he does our website design, adds and takes things off the website as necessary. And then also he does a lot of what are called e-blasts. So
okay.
we have a database of patients that are past patients or businesses or coaches and things like that. And we send them an e-blast on new things we're doing or things we're offering.
That's terrific. It sounds like you've got a great staff. You've got a lot of great things going on. And thanks for 30 years in the community, 30 years of service,
Getting
30
close.
years of practice.
Yeah.
That's fantastic.
It's been fun.
Thank you, Dr. Welchlin.
Thank you. My pleasure.